So good evening. On behalf of My Retired Life Foundation, we extend a very hearty welcome to this very important topic talk today, and that's the taking care of the skins for the elderly people, and that's a very important issue. And we are thankful to Dr. Manish Gautam, who has kindly agreed to facilitate this particular program. And I must express my gratitude on behalf of all of us to our own member, Mr. N.K. Agarwal, who has been instrumental in getting Dr. Manish Gautam with us. So may I request of Mr. N.K. Agarwal to kindly introduce formally Dr. Manish Gautam and to please take it forward. Agarwal sir, floor is open to you, sir. Agarwal sir.
Thank you, Dr. Sengupta. So good evening, everybody. First of all, Haji, am I audible? Am I audible?
Yeah, please. Yeah, audible.
So let
No, there is some problem
so
audio.
First of all, I am grateful to Dr. Manish Gautam. Audio problem, is it? Hello?
Hello? Please go ahead, sir.
So, Dr. Gautam, a very warm welcome to you, to My Retired Life Foundation.
Thank you.
Dr. Gautam is an MBBS from Mumbai University and did his post-graduation DVD and DNB in dermatology from LTMMC, Sion, Mumbai. He has been associated with National Association of Dermatologists, IAVDL, as its honorary secretary and joint secretary, chairman practice management cell, chairman IADVEL media cell, and chairman in charge Astha project Alert India. He was also the clinical head for Center for AIDS Prevention Studies, that is CAPS, University of California. Dr. Gautam is a gold medalist and winner of Dr. Ranganathan Memorial Award. Dr. Gautam has 15 years of dermatology practice and runs his private practice, Skin Solutions, Dermocosmetics and Laser, and he is the chief dermatologist there. Incidentally, his wife is also a postgraduate dermatologist and she is also practicing. He is a consulting dermatologist at Apollo Hospital, Belapur. I am sure our members will be greatly benefited by his talk. Now, before I hand over to Dr. Manish Gautam, I have a small, rather than asking in between, at the end of the talk, in the question answer session, we'll have all these questions addressed by him. And if something is left out, you can refer those to us and we'll get back with the answers to you. Please unmute. Dr. Gautam, please.
Yeah. Hello. A very good evening to all of you. Am I audible, sir?
Yeah, audible, sir. Audible. Please go ahead, sir.
Thank you. Thank you for the kind words of introduction, Agarwal uncle and Dr. Sengupta. So thank you for having me here for this session. I'm really very happy when I see such enthusiastic elderly people waiting for this particular thing. And I'm very happy with this group also. I'm really happy that you are doing some activity and being interactive with each other. So this is really a very good thing. May I start sharing my screen, sir?
Yeah. You are already allowed, sir. Permitted. You can. Yeah. Yes, sir. We are able to see it. Common skin issues in elderly.
I'll just go in the full screen. Yeah, sir. I'll just go from the full screen. Okay. So my topic for the day is common skin issues in the elderly. When Agarwal uncle mentioned that there is a group who would be keen to know about these things, I was very happy to really consent for this. And The thing being that it is a sector where you have to be a little more careful, particularly in our dermatology practice, is when we look at our elderly patients. The reason being that there are a lot of issues which come with aging, and they are mainly responsible for all the issues in the elderly. So when we start thinking about it, let me just give you an introduction on that, so that we all know as we get older, our skin undergoes a number of changes. So the how the skin ages will depend on several factors: your lifestyle, diet, heredity, and other personal habits such as smoking, drinking, etc. The main cause for skin damage is sun exposure over a number of years, which is the main reason that it's because of the sun's ultraviolet light, which breaks down the elastic tissues in the skin. The elastic tissue in the skin is called elastin. So this breaks down the elastic tissue in the skin, and that is the reason where you start getting the damage of the skin. So that skin tends to stretch, sag, wrinkle, and it becomes blotchy also. And very occasionally, not very often, luckily so in our Indian skin, we don't get it more often, is precancerous growths and even skin cancers. So these are the things which can be the reason with the sunlight. But the other factors contributing to skin aging include the loss of the fatty tissue between your skin and muscle. Then there is stress, then gravitational factors, because when we are standing for a longer time and when we know that the veins and the blood vessels, they tend to become a little fragile, the walls also become a little weak, we can say. So whenever you are standing, there is a lot of issues with the blood collecting in the feet, and that impure blood stays back. So we are worried about that issue, and that thing generally leads to an eczema, or another thing which we always think about is the pedal edema. Then pedal edema happens because of various reasons in the elderly. One of them is of course venous insufficiency, but we'll come to that a little later. Then there are daily facial movements like smiling, frowning. Some people are over expressive. When people are very over expressive, they tend to get the wrinkles very fast. They tend to age a little too fast. So those are the other factors. Then obesity also plays an important role while in all these particular factors. Now, coming to understanding what exactly and how this particular thing goes about, we have to understand the skin a little bit. If we understand what are the layers of the skin, I'll just go a very superficial way to just tell you how the skin looks like from the inside. If you have a trans-sectional view, this is how the skin will look. There are three layers of the skin. Excuse me, just give me a moment. I think it is just coming into my. Yeah. So I just wanted to show you how the skin looks like from the inside. So this is the epidermis. This is the outermost layer of the skin, what we see on the surface. This is the epidermis. This is the topmost layer of the epidermis is stratum corneum. I don't want to go into depth of it, but this is your skin from the outside. Just a little below that, we have the dermis. Dermis is this layer of the skin, which is dermis. And then you see this huge layer, which is actually we call it the subcutaneous tissue, or we call it the hypodermis. Okay. So if you see these, if you see the skin, the epidermis, this is the first layer. If you see, it doesn't have a lot of blood vessels or anything. So it is more of a dead tissue layer. Okay. If you see, all the activity happens either in the epidermis or in the dermis, or below that, which is the subcutaneous tissue. So if you see all your hair follicles from where the hair comes out, your sweat glands, their roots are all in the dermis. Your blood vessels are very much there in the dermis, even to that matter that you do have nerve endings. So you can see these nerves are there. These are the nerves endings which are coming out. Okay. So nerve endings do come out to the top, but otherwise blood vessels are mainly located below and they open out into the top. So you can see that these are the things where how the skin structure is divided into. So the skin is the largest organ of the body. It protects us from microbes and elements, like helps regulate the body temperature and permits the sensation of touch, heat and cold. मतलब जो भी हम sensations feel करते हैं वो skin के ऊपर, वो they are just happening because of these particular things which I just showed you. So all these things are the part of things where you can understand how the skin actually works. But skin has doesn't look just like, you don't have to think of skin as only an organ which has got no use as such. The reason being, the skin, as I mentioned here, it regulates your body temperature. Suppose if your body temperature doesn't get regulated, you will have either hypothermia, which is cold chills, and you will not be able to maintain temperature, or you might also experience hyperthermia, which does happen in elderly people. I'll come to it a little later after this. Now coming to the other part, the skin, as I said, the epidermis, it provides a waterproof barrier, indicates our skin tone. The dermis contains all the connective tissue, the hair follicles, sweat glands, as I mentioned. And a very important part of the skin is the deep subcutaneous tissue, which gives you that taut sensation of the skin, which is there in younger people and which is gradually diminishing in elderly people. So the skin's color is created by special cells which are located in the epidermis called melanocytes. That is how our color is decided. How do we look different from the fair individuals? How do we look different from the people in the West, and how are we different? So we are in the skin type 3, 4, 5, 6. 1 and 2 are in the Americans, Europeans and all. They are on those sides. 5 and 6, and even for that matter, people in Africa and all, they come under 5 and 6. So we generally, maximum Indians would fall under the category of 3 to 5 skin. Okay. Now that is one of the reasons why I'm talking about this skin, is because a dreaded kind of a malignancy called melanoma is not so often seen, or the skin cancers are not often seen in Indians, because we are already having a lot of melanin. Where we don't have melanin, we don't have the pigment, then we are likely to get these problems. So I will be just touching upon most of the things, and then I will move on to show you photographs. And of course, those photographs also, I will talk a little about them, just to make you aware where you are supposed to be worried about, where you need not be so concerned about, which is a normal way of aging. So there is something called normal aging versus something which has got an abnormal way of skin problems. So that is what we'll come to. So then coming to the aging changes, I'll just take you along with this. With aging, the epidermis thins out. Now that I have told you what are the layers of the skin, this will be a little easy for you to understand now, that the epidermis thins out, even though the number of cell layers always remains the same. Okay. The epidermis thins out with the thing, and the always the turnover of the skin which is happening. I'm sure you everyone knows that we are not right now having our skin we were born with. Okay. Our skin, the top layer goes off in every 25 days. Okay. You can say that the skin layer goes off in every 25 days. But in certain skin conditions, this turnover increases. And that is where you get the skin dryness and all those patches. Okay. So that is one thing. Then as we age, the number of pigment containing cells, the melanocytes, they decrease. The skin looks thinner, paler and clearer. So that is why your veins and arteries and all are more visible when you are elderly. Okay, when in a younger person, you don't see those blood vessels. Otherwise, the blood vessels running under your skin are never seen. As you age, they become visible. Secondly, they become thickened because of some deposits in the vessels. The atherosclerosis, which we call, which can create the reasons for heart attack and all those things. So atherosclerosis makes the skin, the vessels a little more thick and easily visible under the skin. Okay. Now coming to the lower part is the connective tissue, which we said in the lower part. They reduce the skin strength because the connective tissue changes, they reduce the skin strength and the elasticity goes. That is why your skin becomes little lax, loose, and that is why it becomes a wrinkled kind of a thing. Okay. So this is known as elastosis, but it is more noticeable in sun exposed areas, because if you see people who are farmers and people who have been working out in the sun for all long number of years, their skin becomes more wrinkled, more aged. They turn to aging more faster. So that is why, as I said right at the beginning, the biggest damage is caused by the sun. over the all the years, the damage which is happening to the skin happens with the sun. So if you look at it, even in your skin, if you see your skin which is in a covered area will be less damaged or less aging as compared to the skin exposed on your forearms, on your face. That is why you see more wrinkling on the face and other things. If you see the aging, this shows more on the face, and that is how the thing goes on. Again, going ahead, the blood vessels of the dermis become more fragile. That leads to bruising. You know that elderly people generally, if you say they bruise very early, you even if they have got a little bit of a injury, very slight injury, they suddenly bruise. So that kind of a thing is because the vessels have become a little weak. Okay, if they have become fragile. So we have to look at that aspect also when we are thinking about keeping our skin nice and taut. Okay. So then you get those senile purpura, we call it. These are not damaging. They are not a problem because this purpura, they happen even in a younger age group, but then that time there is something abnormal about it. In senile purpura, that is in elderlies, when you get a little bit of a bruising and it settles down in 4 5 days, then you have to understand that is because you must have by chance just rubbed your skin somewhere or hurt your skin somewhere, and that could have given you this issue. Okay. So then we come to the oil glands. We have the oil glands in the skin also. Obviously, that is why your skin becomes so nice, soft and supple. Otherwise, it becomes very dry because they produce less oil as you age. And men experience a minimal decrease. Men will not have a problem till even 60, 70. Even after the age of 80, of course, is a different story. But even by 60 or 70, they won't have it. But in the case of females, there is a problem because the oil beginning to get less or the skin becoming dry starts right after menopause. So just imagine if a lady has a early menopause, say around 40 or something. So by 50, she will you start looking like 60 plus if she doesn't take care of her skin. So the menopause also keeps a very important, plays a very important role in a female, that when the skin is going to start looking different. Okay. So this is the reason that when the oil is less, that will result in dryness and itchiness. Always keep this one thing in mind, that a dry skin has got the maximum tendency to scratch or itch. Okay, you will get more itching if your skin is dry. You must have noticed it whenever you feel very dry or itchy in the winters, whenever you just apply a little coconut oil, and lo and behold, it is very good. You're feeling very nice and the itching is absolutely vanished because the skin has got those sensory nerve endings. When the skin becomes dry and there is friction, the skin sends a message to the brain that there is something wrong, and the message conveyed to the brain comes back as itching. And then when you start scratching, you are creating a very vicious cycle, which is we call the itch scratch cycle. When you scratch, more itching, itching, scratching, itching, scratching. That is why the eczema becomes, or the thing becomes a very kind of a problem kind of a thing, wherein the skin issues start troubling some. Now, I'm trying to be as easy on the language. So if you still don't understand something or something, just please put it down in the chat box. I will definitely be happy to answer them later on if there is something which doesn't really come to you. It's a little different because the words are little complicated here and there. I'm trying to make it very soft for the thing that you can understand. Similarly, now you know that the fat also thins out. As a whole, the skin is getting atrophied. Do you understand that the skin is getting thinner with the age in all the layers, not only in one layer? So even the fat reduces. So when there is fat reduction, there will be less insulation. Because you have fat, that's why you don't feel very cold or chilly. You understand? Anyone who is obese is always feeling hot, and a thin person always is feeling chilly. The reason being because the fat is different. They don't have a fat insulation. Okay. A thin person will always feel chills. The other person would be a obese person, or a little fat person would be always feeling hot. So that is why, because of the fat also. So the subcutaneous fat layer, when it is gone, naturally the skin has become thinner and there is no insulation, no padding. So injury chances are increased, and the temperature maintenance, body temperature maintenance also goes for a toss with this. So we have to understand that also as other changes. Secondly, some medicines are absorbed by the fat layer, because that is another issue which always torments us. Because for the elderly there is a lot of medicines, that is called, we call it polypharmacy. Polypharmacy means lot of medicines are there. There will be multivitamins, there will be for blood pressure, there will be for diabetes, there will be for the lipid lowering agents, there will be something for the heart, there will be some other things which are other comorbidities, thyroid or other things. So it becomes actually a big baggage of medicines at many times. So that is where we have to keep a tab on things, that this particular thing also might be giving the issue. So we have to take care of the medicines also. And as we age, the sweat glands produce less sweat. It makes it harder to keep cool. And your risk of overheating or developing heat stroke also increases. Now, see, there are two things to it. You got it? Now, at the same time, this is why it is complicated. In elderlies, you can get a hypothermia where you can feel cold also. But at the same time, because your sweat glands are not producing sweat, you can always also have a hyperthermia or a brain stroke or a heat stroke. So we have to be little careful about our skin. So that is why you have to maintain according to the climate where you are staying. How about to maintain the temperature and all the things, maintain your hydration, not only by skin from the top, but also adequately in your diet. That is a very important thing, that you adequately hydrate yourself. Then you must have seen those skin tags which you have in elderly people or even in younger people who have a little weight, and those are excessive skin tags. I'll be showing pics after this, and then you will be able to understand which I'm talking about. Then there are brown rough patches called seborrheic keratosis, which are a part of aging. So there are certain times where these tags or these skin problems or warts, of course, are viral infections, but skin tags and these brown rough patches, unless and until they trouble you or they look cosmetically bad to you, they are not supposed to be worried about. But if any of these skin tags suddenly increase in size, they become bleeding, or this seborrheic keratosis starts showing some pain or some unnecessary increase, then the moment you have to rush to your dermatologist, because then there is something wrong with it. Okay, so these are the small things we have to understand. Similarly, when you have on the face some patches, they have a very small chance. As I said, in India, we have a very less chance of this, but we do have cases of cancers of the skin. So these are small chances of becoming a skin cancer also might happen with this actinic keratosis. Okay. So, so what are the effects of these changes which I just discussed? I'll just go over them. I'm already gone through when I'm talking about them. So you are increased risk for skin injury. Your skin is thinner, more fragile. I'll just go over again. Protective fat layer is lost. And that is why you are less able to sense touch, pressure, vibration, heat, and cold. And rubbing on the pulling on the skin can cause skin tears. That is another thing which will easily make you feel. Fragile blood vessels can break easily, as I talked about the purpura and the blood collection of hematomas. They can form even after a minimum injury. Then also what happens with this is pressure ulcers can be caused. You know that about patients who are bedridden and then they have those pressure ulcers. Okay, how do they happen? If a younger person, if he's bedridden, he's not likely to get the pressure ulcers very fast. But an elderly person would definitely get it much faster because there is no covering, there is no fat, no insulation. So that is why if there is a hard bed, and then the patient is lying on the same thing, the skin gets rubbed between the bone and the hard bed. And that is why we always advise for a water bed or an air bed for people who are chronically bedridden. So that is why you have to be more careful. And then we always come down and see to it that they have to change positions and all those things. Okay. And sores, as I said, they are most easily seen on outside surface of the forearms. These are the areas where you see them more often, because if you're sitting like this, you're not realizing, you might get them. Okay. So aging skin, the worry also is that it repairs itself more slowly than younger skin. And the wound healing may be multiple number times slower than a normal skin. So that is why diabetes and other infections and other blood vessel changes, they also add insult to injury. You can say that, because then already with the age, things are not getting better faster. And everyone knows that diabetics have an issue with healing. They get recurrent infections. That is why we have to be more careful. So there are the two types of skin aging, as I was talking about it already. There is the intrinsic aging, which is due to normal maturity, which we all see in all individuals. But again, adding the trauma to that is the extrinsic factors, that the UV exposure, smoking, environmental pollutants, and decreased mobility, drug-induced diseases, and increased incidence of many other diseases. That is why an elderly patient is more risk for skin diseases. The elderly individual has got a more risk for skin diseases. I'll then just discuss, because the things which there are a lot of other things which can be discussed, but as I said that we need to discuss what is important for my audience right now, people who are listening to me. I know my what they want to understand, and that is why I'll mainly discuss about the most important thing which happens as a normal part is xerosis or dryness of the skin. Okay, so the dryness of the skin is characterized by pruritic, that is itchy, dry, cracked, and fissured skin. It's most often on the legs of elderly patient, but may be present on the hands and the trunk also. Its appearance is like a pattern of a cracked porcelain on your porcelain dish. So that is why. Or so these cracks, excuse me. Yeah. Sorry, thank you. Sorry for the break. So appearance is like a pattern of cracked porcelain, and these cracks or fissures are present from the epidermal water loss. Okay, the loss from the skin. So primary due to decreased oil and sweat gland activity, this reduced activity predisposes the aged skin to moisture depletion. The moisture becomes less in the skin. So that is how the problems start in the skin. Okay, and if you see in the dry skin problems are going to increase in the winter when there is a lower humidity environment. And another contributing dose, another contributing factor is the daily use of cleansers and bathing. That is why I have an advice for my all my elderly patients is try not to use soap every day. And see what produces problem of dirt and thing is either you sweat a lot or your skin is very oily, but which is already getting less with age. So the point is, if you are going to wash every day and use a harsh soap or everything, your skin, you are removing the बचा कुचा तेल भी आप निकाल दे रहे हैं स्किन में से. जो आपके बचे कुचे ऑयल जो बचा है स्किन पे वो भी निकल जाएगा. You will not have that also. So the point is, if at all you're taking a bath, let it be with plain water or with a very, very mild soap, like even soap cleanser. I would say we nowadays have a lot of soap free cleansers for elderly people, and that is also useful for the babies. So and we everyone knows the baby skin is sensitive, so is an elderly gentleman's or elderly lady's skin. So we have to worry about both things. We have to care for both the things in the similar manner. So if we are doing daily use of cleansers and bathing, that is going to replace the natural skin emollients. And another additionally, like pre-existing disease states and their therapies. For example, if you are a diabetic, if you have treatment for your cholesterol, so all these medicines, they are known to dry your skin further. They make the skin further dry. The disease itself, the burden of the medicines, and to add to that, the normal aging. So the point is, in all, we are having a losing situation. So for getting into this particular thing, what you have to understand is the most important thing is moisturize your skin, moisturize your skin, and moisturize your skin. That is your primary thing which you have to. Don't think about whether you look at it whether dry or not. And if you see any of you would try using a moisturizer, and the moisture stays not more than an hour or hour and a half. After that, suddenly your skin becomes dry again. So the point is your skin is actually greedy for the oil. It's greedy for the oil. It's lacking it so much that it needs it very much. So you have to give it in good enough quantities. And that is why you have those moisturizers, which are a little more long standing. They stay for at least 8 hours. There might be any in the market. They will promise you about 24 hours and 48 hours. I'm sorry, nothing like that happens, ma'am or sir. They are going to take at least more, not more than maximum. The best one would be staying for 8 hours, and that would again be replenished. That would have to be required to applied again. So that is very important to understand. So these are the things that the aging individual becomes more susceptible to cirrhosis. And there are most conditions, if not all, I would say, are related to only and only dryness. That is why I'm discussing this. So look at these. These are the, I have chosen this particularly as an elderly person, but there are two or three things. If you see these black spots here, These black spots are because, and you can see they are going from here. You must have seen this in many of the people. I mean, many of my audience today would also be seeing on their legs. So these spots here are a part of, as I said, when there's a continuous standing and the blood vessels are not able to carry the blood back for purification. There is an impure blood which stays back in the legs, and then there is a pigment called hemosiderin which is coming out onto the skin. And this hemosiderin, if not taken care of, because it is, you can say, a part of the impure blood phenomenon, you can start getting the eczema. That is why elderly people have a lot of itching on the shin areas and all. Okay, so that is one of, and this is not only true about elderly people. So it is also true about people who are overweight. So if there is an overweight person, naturally the gravity is working against that person when the person is standing. So all the blood gets deposited in the feet, and that is why they start getting these eczemas and other things. Now, again, if you see here, there are those scaly spots here and there. That is because of the dryness, and that is why, as I said, that xerosis happens more on the legs, and if you see it's little around the knees also, it's there. Okay. I'll show some other pictures which are related to other conditions where the dryness is more. And here, just keep these things in mind, what I've shown you here. Anyone would feel this is something like a white spot disease or vitiligo or something of that sort. No, it is not. As your hair gets gray or turns gray, even your skin might lose melanin at certain spots with age. Okay, the pigment has gone there. Melanin is lost in vitiligo also. That is the white spot or full berry bolte hain hum log jaise. But this is not vitiligo. This is a part of normal skin aging. So this is not to be worried about. You can see quite a few here and there. But if you see anything very big patch, because these size, these things, we call them idiopathic guttate hypomelanosis. Don't take the name into account. Just remember they are nothing to be worried about. So these are not a disease. They are just normal aging. Okay. So I was talking about the pre-existing situations. Again, radiation, because for any person undergoing treatment for malignancy, a person is end-stage renal disease. If the renal disease patient also, they don't have a lot of, the fluid retention happens and everything, and the skin is getting dry day by day. The skin is getting dry. So that is where all these xerosis happens. Then thyroid disease can give you a dryness. Then nutritional deficiencies. If you are not able, your body is, you're eating well also, and your, first of all, the nutrition reduces with age. Secondly, many times the nutritive value goes down. Sometimes you might also face some other things, like for example, uh, absorption is not getting from the stomach. So all these things would have to think about these things. And then neurological disorders. If someone has Parkinsonism is one of the conditions where xerosis might happen. Then there are other conditions where any neurologically a person has started reducing sweating and all those things. It's become a little, for example, a person with hemiplegia, a person has got one side paralysis, or so those things also, those people also have tend to have a dryness of the skin. And then there are diuretic therapies where the swellings, and then malignancies. So I'll just go over these pictures now to just tell you how the things. Now here, if you look at it, this is a normal looking mole. Okay, a mole which is there, आप जिसको तिल बोलते हैं, मस्सा बोलते हैं, ठीक है? So this is something which looks like that, but you look at on the surface, there is a little bit of irritation. Now this is normally there because this is not an elderly person here. I'm not worried here. Okay, I'm showing this just because if I see something similar in an elderly person, I'll get a little alarmed. Okay, and this lady here, if you see, she's an elderly lady. She's got this kind of a growth out here. It looks as if some kind of an eczema is there. Okay, but this is not an eczema. This is a cancer, proven cancer. This is how it looks. It looks like, you might think that eye drops ki allergy ho gayi and all those things. People come to me with that only. She came to me saying कि मुझे eye drops की allergy हुई है, डॉक्टर साहब 6 महीने हो गए, ये ठीक ही नहीं हो रहा है. Another thing, ma'am and sirs, is the duration of an illness. A duration of a problem staying for a longer duration is unlikely to be something non-problematic. It has to be something which will alarm, which should raise a red flag in my mind that, okay, this thing has been there for this elderly person for some time, we have to worry. Look at this. Coming to this, this is a classical carcinoma. This is a skin cancer. Look, it started as a very small thing. He said that he did not have any issues, that just had a pain and something, and in the dental pain, and that later on turned out on the surface it was brewing inside like an malignancy. So these are the things which you have to keep in mind when we have to. Now this is a very normal looking skin tag, okay, and there is skin tag excessive kind of a thing. Here what we do is we just excise this skin tag and just get rid of it. There is a little bit of calcific deposit on this, but it is not something which will raise a alarm in my mind. I can get rid of it without worries. Here again, this is nothing to worry. What is this? This is DPNs or your excessive skin growth. Over years of damage to the skin, wrinkling of the skin is seen, and that is why these over here are, we can say DPNs, we call them. They are like skin tags which happen on the face. Skin tags on the neck and all, they look on the skin colored, but when they are on the face, they don't look skin colored. They are darkened with age. So they look a little different. These are DPNs. So that is how it would look. Sorry, I have to show some pictures. Just they are, we cannot get always a milder thing to show. These are blistering disorders where again your blood vessel, sorry, not the blood vessel, the skin, there is, because of fragility, you can see there is a blister formation. These are blistering diseases and they are very problematic. We call them bullous pemphigoid, pemphigus. These are because the skin has peeled off. And if you think about this skin peeling off everywhere on the body, it is almost similar to a third degree burns में जैसे skin निकल जाती है. Okay, so we have to treat it like a very, very important disease or a very emergency situation. Okay, so we have to go ahead for very immunosuppressive medicines, etc. Now this is where I wanted to show you the dryness of the skin. See, this is xerosis, but here this is, if you see the dryness of the skin, this is not normal dryness. You can understand, no one has dryness like this. घर पे बैठे बिठाए किसी को ये dryness थोड़ी होती है. Because ये dryness जो है, he has got a particular condition which we call as erythroderma, wherein because of psoriasis, which is a dry skin condition, he has got into this particular situation. Maybe he did not take the medicines adequately or the treatment was not done properly, but he has landed up in a, sorry, I'm sorry. He has landed up in a situation where the skin has become very dry. This is jumping, I don't know. Just excuse me. Yeah. Okay. So that is why. So that is why his skin has become a little different in that. Now here, these, if you see, this is an elderly lady. She can see that she's on the, she's a little on the obese side, and that is why she's getting these lesions, these growths over here. They are severely itchy, very itchy growths. This is, we call it as prurigo or lichen planus, we call it. And these, if you see, are something because of long standing, they stand a lot, and then the lower legs, they become a little vulnerable to itching and eczemas. So they happen more on the lower leg. This can happen rest of the body also, but it is more prominent in the lower legs and all. This I have particularly kept. This is about the fungal infection, which is becoming almost like a pandemic for us to see, because these, if you see, this is a ringworm infection. These are all patches of the ringworm. And in elderly people, I have, when there is a polypharmacy, they have so many other medications. If an elderly person gets fungal infection, it becomes a big problem. Why I have kept this here is that please don't use any cream from a chemist to treat the fungal infection. Please don't do it, because that is the biggest reason that we are facing this almost a pandemic like issue with fungal infections in the last 7 to 8 years. Because आपको सबको पता होगा, you must be knowing that when you had a ringworm infection, even your TV advertisements would have shown one cream would have been enough. But it is not that way now. It is not that way now. This has become a big issue for us. The fungal infection goes on and on and on, and it doesn't stop. It just goes on. And this is why when you apply a cream which has got some steroids inside it, this rashes increase on the margins and they become more and more troublesome. Okay, so that is why when you are having a fungal infection, or if you feel anything which looks like a fungal infection, you have to just go and visit your dermatologist. Don't take any treatment from a chemist. Or if you're a physician also, you today onwards, all my audience today will be strong enough to ask them, इस cream के अंदर steroid तो नहीं है? Steroid जरूरी हैं, कहीं पे steroid जरूरी है, but if you have a fungal infection, steroids are contraindicated, zero. They create a big problem. Now, I showed you those photographs. I showed you that there is the aging factor, that the white spots are there. So this is again looking that similar way. Look at this. They are the aging factor. These are the spots. Again, they are at a certain thing, but this is a red flag. Means this can be vitiligo also. This can be those aging spots also. So I have to keep a watch on my patient, a regular follow-up. I will see that कोई भी patches ज़्यादा बढ़ तो नहीं रहे हैं, सब ठीक ठाक उसी में हैं, और किसी भी चीज में कोई अलग ज्यादा चेंजेस तो नहीं आ रहे हैं. So that is why we have to keep a watch on these ones. So that is why I kept these photos here also, because generally these occur on the legs as seen here, but most of the time in elderly people you see it on the abdomen also. पेट पे, दोनों हाथों पे और पैरों पे होंगे तो घबराइए मत, छोटे छोटे होंगे तो घबराइए मत, जरा भी कोई बड़े बड़े दिख रहे हैं, अलग जगह पे दिख रहे हैं, you are definitely going to see your dermatologist for that. In fungal infections, I have kept another one because of this steroid thing. That is, this is which we have to be a little more careful about. Okay, and just give me a second, please. Okay, sorry. And now coming to this particular, this gentleman, I have kept this particular photograph. This is a drug reaction. It's a severe drug reaction. Now what happened in his case was that he developed a reaction to medicines. Okay, and when I checked his list of medicines, he was on 35 medications, and out of that 35, he was on 35 medicines. Now it is like searching for a needle in a haystack to know which one has caused him a trouble. Luckily with intervention from because I'll tell you what happens actually. What happens if you are having multiple doctors treating you, he's a patient of renal compromise. He's got renal this thing disease, and that is why he's on multiple medicines. He's diabetic, he's on hypertension, he's a history of ischemic heart disease in the past. So he has at least 35 medicines on that day when I went to see him first. So when I saw him, I said, it is very difficult to really come to a conclusion of this. Luckily, with the intervention of another senior physician who just said, Manish, whatever you want to stop, you stop. I said, sir, I want his medicines to reduce to only 5. 5 medicines पे लाइए इनको, 5 या 6 पे. Or I removed all the drugs which were causing. When this kind of reaction from his list of drugs could have been caused by 15 to 20 types of medicines. So I removed all the medicines because there is a lot of issue with this. Please see to it that I know there will be, इसके लिए भी दवा है, उसके लिए भी दवा है, इसके लिए. So there were a lot of medicines. So anything can cause a reaction. When I stopped, I'm not able to show the earlier photograph, but when I stopped all his medications, this is almost on the waning off. I have not given him steroids. I have not given him any other medicines to treat, just because with this his itching vanished with just stopping the medicine. The importance of just removing the trigger factor. I just want to say the trigger factor, not only in drugs, even in your day-to-day life, if at all, if you are using perfumes or if you are using something which is alarming, even if your diet contains some preservatives or something which can be causing the itching, Just remove the trigger factor. You don't need to be taking medicines for that. So that is the importance why I kept it here. This gentleman he improved over 5 days in Apollo, just doing nothing. I just stopped all his medicines. He went home after 4 days. So that is, otherwise you would have stayed in the hospital with this drug reaction for 15 to 20 days at least. I would have also done the same thing, added 2 more medicines to those existing 35. So that is how the thing is, where to give or where not to treat is also a very important thing in this particular thing. Now, these are oral ulcers. Most of the time we do get because of nutritional deficiencies. I have kept them here because if you have an oral ulcer which has not subsided for some time or it is recurrent, see here, this gentleman has got a little dental caries here and other than these oral ulcers are there. And that is why you can get skin conditions on the oral cavity also and in the skin as well. So we have to consider all those factors. When you see any particular thing that is not subsiding for some time, please be sure to see for this particular thing either a dermatologist or a ENT surgeon, or even for your by the matter a dental also. So ENT surgeon. So but here generally we have a lot of skin conditions which have oral manifestations. That is why we can correlate better with them. This is psoriasis of the scalp. Psoriasis is a dry skin condition where your skin turnover increases to 5 times the normal. So you have to be more careful in the terms of moisturizing. This is not abnormal. When you have abnormal turnover of the skin or of any tissue, then it is called malignancy or cancer. When you have normal turnover of the skin, it is psoriasis. It is not something to be worried about, but yes, concerned about, because it can be associated with arthritis, joint pains, and other things. And most of the time it's limited to the skin, but it creates a lot of debilitating problems. Your hands and feet, you cannot move and all those things. So we have to be a little more aggressive in treating these conditions. So what are my take home points today for you is, please have a reduced frequency of bathing, and you can have bath with lukewarm, not hot water. That is very important. Minimal use of a non-irritant soap. Avoidance of harsh skin cleansers. No harsh skin cleanser should be used. Application of moisturizer of choice directly on the skin that is still damp. Reason is very important. Don't try to scrub your skin dry. Try to always pat it dry when you take a bath, so that your skin retains a little bit of moisture. When you apply a moisturizer on a damp skin, it absorbs it pretty well and it stays there. It stays for a longer duration. Otherwise, you'll be just putting moisturizer or a dry skin, which is useless. And any skin condition which has got dryness or anything involved, like your cracked feet, or even if you feel there is some kind of a thing which is always pick a point to moisturize the skin before applying the creams or the oil or the moisturizers. Moisturize the skin in the sense, dampen the skin, sorry, not moisturize, dampen the skin before you apply. So keep your feet in warm water. If you have cracked feet, 5 minutes, 10 minutes, then उसके बाद आप उसके ऊपर cream लगा सकती हैं, then it will get absorbed faster. Okay. Anyways, any dry skin also, any dry skin problems, this is the normal way, is to apply the moisturizer on a damp skin when it is still damp after a bath. No scrubbing. Avoid is the friction from the washed clothes, rough clothing, and abrasives. Have to be very careful about it. Whenever even you are using, suppose you are washing your clothes even in the washing machine, but even if you are putting your hands to remove the clothes and all also, then you have to understand that your detergents and your cleanser should be very mild. Because why? Elderly people, the skin is not creating so much of dirt and everything is not going to happen. There is not going to be a lot of sweat. So don't go in for very harsh cleansing. Try to be gentle with your cleansers. Okay. And if you are in a dry environment, you should have air humidification. Even for if you are sleeping in an AC, try to moisturize your skin. What does the AC do? It removes the moisture from the environment and throws it out, right? So you have to moisturize your skin when you are sleeping in an AC, because you tend to have more dry skin if you are sleeping in an AC. That is another thing. And very liberal use of sunscreen. I feel that there is no one who should be limited to their life, and can go out anywhere, enjoy life. And I feel it is always good. Uh, for example, I can say about Agrawal uncle also. I see him as a very fit gentleman all the time. He's an inspiration for all of us. So that way, I feel that when you are going out, just be cautious about things, don't be making that limit your movement. Please don't think that you are limited your movement. But yes, use a sunscreen, protective clothing when you're out in the sun, because whatever chances of sun damage, why do you want to look older before you get old? Right? You have to look your, you can use, I can give you an option of looking younger than your age. That is always there with me. But then why to look older than your age? If you want to look, you look your age, or at least look younger with my help. That's a different story. But if you use a sunscreen, you will definitely have a much younger looking skin. Chances of aging are less. The solar damages, the patches which I showed on the skin, those things, they will be less often visible. Or they won't happen rather. So do not neglect an irritation, bleeding, or pain in a long-standing mole. Okay. All itchy patches are not eczema or fungus. They can be sometimes a pre-malignant tissue. So if you are having a patch which is थोड़े दिन क्रीम लगाते हो ठीक हो जाता है, फिर वापस आ जाता है, थोड़े दिन क्रीम लगाते हैं ठीक हो जाता है, या तो आपकी क्रीम गलत है या आपका पैच वो है ही नहीं जो आप सोच रहे हैं. So you have to consider the doctor's advice on that. Recurrent fungal and bacterial infections, if you are not ever detected to be a diabetic, I think everyone must be getting a regular blood check done. But if at all, if you are not detected to be diabetic and you're getting recurrent or bacterial and fungal infection, think about diabetes. Always carry your list of existing medications when you are visiting any doctor, because a lot of interactions happen when you are taking the medicines. And that is why if you are not giving us a list of whatever you are taking, we might unnecessarily or unknowingly give you a medicine which might interact with the other medicine and put you in trouble. Keep an allergy card in your purse or wallet. This is my advice to everyone because I'm a dermatologist. I want that you should carry in your allergy. If you are allergic to any medication or any food, also just carry it in your pocket, so that food, of course, no one would go give you unknowingly, but like allergy, if you are particularly allergic to sulfur or any medicine, and suppose you are admitted somewhere, or suddenly, God forbid, you have an accident somewhere and you need to be taken to, they would unknowingly give you that medicine. If they have an allergy card with you, then you can definitely show that. Okay. So that is how it would be. And many diseases in dermatology are chronic and they require a lot of maintenance treatment. Me generally, or any dermatologist, would be very happy to treat with the least medications, basically, because the beauty about the skin is कुछ आप बाहर से लगा के भी मैक्सिमम चीजें ठीक कर सकते हो, क्योंकि आपकी डैमेज स्किन बाहर से है. तो आप जो अगर when you take good care of your skin, you might not end up seeing a dermatologist more often for that skin problems also. And the second thing is that if there is any creams or something which can be used or continued for a longer duration, they have to be continued. Okay. So these are what I would have thought were important. There might be some other things which you feel would be there. You can just definitely put it in the chat, or you can just ask the questions now. Then I'll be happy to answer. And thank you so much for your kind attention.
Thank you, sir. Thank you very much. There are certain questions in the chat box, sir. If
Stop the sharing, then is it okay? Yeah.
yeah, can stop
Yeah.
sharing.
Yes, sir. I'll just see the chat box now. Now that I'll please, sir. Okay.
You can see, or should I read?
Yeah.
Any relation?
There is a question from Mr. P. Jairam. Any between chronic rheumatoid RA is rheumatoid arthritis and fungal infection. Perfect circles are about a centimeter, controlled by ibuconazole cream. A word about scalp itching, please. Okay. Mr. Jairam, the thing here is, I'm sorry, I'm Mr. Jairam, or so I would just say that rheumatoid arthritis is not a thing which is directly going to be connected to the fungal infection. But yes, indirectly, you are a little prone, like as I said, for fungal infections, any kind of immunosuppression might be contributing. So chronic rheumatoid arthritis, because you are on, if I'm not wrong, you might be right now on methotrexate or other drugs which are similar for rheumatoid arthritis, or there might be, these are all called immunosuppressants. They have got an immunosuppressive ability. So when you have a fungal infection and this, then there is a chance that you could be correlating to controlled only by ibuconazole cream. I don't think it is going to clear out fully. It can gets control means maybe you need to see whether you need a oral medication for that also.
I completed a oral course.
Yeah.
I did complete a oral course and then I am on Abercon also.
Yeah. But and how good are you with that, sir?
I'm okay.
Yeah.
Okay,
So it does that.
that
So if at
circular
all,
patches come up once in a while. That's all.
yeah. So basically, if you have taken the course and if you don't see if you see that if it is coming back and again,
Yes.
so then you need to again understand whether your course was complete or not. Because
Okay.
rheumatoid arthritis, the other medications of antifungals, they don't have a lot of interactions. So you can still go ahead to treat yourself with another course of oral antifungals by a dermatologist. So,
How
okay.
about the scalp infection? How do I fight it?
So scalp itching, sir, there is, as I said, there might be like umpteen number of causes for scalp itching. So you cannot just call it as itching is just one symptom, sir. So if you feel itching, whether it is because of the fungal infection which you have elsewhere, or is it generally been there all along? So you can just first try putting as a moisturizer or some oiling. Does it help you? Whether it gets better with oiling, then it is good enough. It is just a age-related changes. But if the itching becomes more aggressive, when you are stressed out or some particular time of the day, then you can understand there could be underlying factors.
Okay. Thank you.
Right, sir. Uh, I have allergies. Do I have to avoid dairy products and gluten? And this is a very very what do you say um, an open question. It's basically because it is like what kind of allergies, and that could be decided by a doctor. And allergies, do you have skin allergies or do you get allergies due to a particular, like do you get allergies like sneezing or something, or this is skin allergy? If you're having skin allergies, then dairy products per se cannot. Gluten can give you another condition called dermatitis herpetiformis, but that people, very few people, if proven, then only we have to stop gluten. Not everyone. We are born when we have been taking a wheat based diet since our childhood, so we generally don't develop so much of thing. But if you think that you might have this, you can go in for a allergy test. There is a allergy test where with you can just with a blood test you can confirm the number of, there are food items, there are around 150 food items which are listed in that, and your allergy test has been done, and that will show you whether you are allergic to any dairy product or any gluten product. And if at all in your daily routine you have felt that you have seen that allergy to a particular food, that is the best test. Then you don't need a test. इफ यू नो दैट यू आर एलर्जिक टू दिस फूड, यही खाने के बाद आपको प्रॉब्लम होती है, तो आप उसको छोड़ सकते हैं, उसको अवॉइड करके देख सकते हैं. तो वन और टू आइटम्स इफ यू आर एलर्जिक टू, यू कैन बेटर अवॉइड देम. But if it has been a number of things, you are not able to understand what is causing it, then you have to get the test done. Okay, right. Again, ma'am, your questions are a little broad based. Advice for autoimmune disorder. I have at least 25 autoimmune disorders which I know about. So I don't know which one we are talking about. There is SLE, there is lichen planus, there are many other connective tissue diseases. So I wouldn't be able to answer this. I would need a little more specificity on this question. Autoimmune disorders is autoimmune disorders means your immunity is going against you. So you have to understand that you will need something. Sorry.
डॉक्टर साहब मेरा फिंगर्स में प्रॉब्लम्स आया था आई
हाँ जी.
कंसिडरेड फिंगर्स का एंड ऑफ द फिंगर्स में प्रॉब्लम आया एंड लॉट ऑफ allergies I face with the surf, with the vim and sanitizer, with
Yeah,
the
ma'am. That is
Dettol.
what this is all contact, ma'am. This is not related to your food. So why do you stop? Why would you stop food for that? है ना? आपके हाथों पे जब आप डिटर्जेंट्स को अवॉइड करिए, आप डिटर्जेंट्स को अवॉइड करेंगे या फिर आपको
लेकिन डिटर्जेंट से अवॉइड करने के बावजूद भी कुछ नहीं हुआ था.
आपको है ना मॉइस्चराइजर
Creams
करना
I
है.
have applied and all allergy tablets also I had taken, but nothing happened.
So then the point is you will change your detergent and you will stop using the detergent. You are आपकी एज पे तो बात अलग है मैम. अगर इवन यंगर पीपल इफ दे आर एलर्जिक टू अ पर्टिकुलर डिटर्जेंट और इवन समथिंग लाइक दैट, they are not supposed to use it. That is very clear. For at least a time till your brain forgets about it. How do we remember people
So
seeing
many things, sir. So many things. Detergents, vim liquids, sanitizers. Many
तो
things
सारी
are
चीज
there.
तो हाथ पे ही हो रही है ना?
हाँ, हाथ में ही हो रही है.
क्यों? क्यों? जहां पे कांटेक्ट हो रहा है उसी से हो रही है ना? तो आप
किससे हो
मॉइस्चराइज
रही है?
करिए. You just moisturize your skin and see, why do you want to use a sanitizer? You don't use a sanitizer. I'm telling everyone all here, all our elderly patients, I'm telling don't use a sanitizer. You can wash your hands with a gentle cleanser. If you're
नहीं,
using a
आजकल में पैंडेमिक में
contain alcohol,
सैनिटाइजर करके we carry it and use it there everywhere.
that is what Andy, no, don't use it. That is what I want to tell you. I'm telling you, use the moisturizer. You can wash your hands. That is more important. And if your mask is covering you, why do you want to, what are you going to touch with that hand? Okay, so you have to understand, don't use, because your skins would not tolerate sanitizers. Maximum patients of mine, either online consultation or offline, whenever they have been able to come to me, elderly people have come in the last 1 year only and only for hand allergies. So that you have to understand. You cannot use moisturizer, you cannot use sanitizers, or you can try to avoid them, but use a very mild detergent and use a very good moisturizer.
Thank you, sir. Thank you.
That is the only thing which is going to help you. As I
Thank
said, it's lacking in your skin, so you have to replenish it with something. Okay. Then question, please. Okay. Right. Please enlighten us for cons and calluses. For cons and calluses, as I said, moisturize your skin regularly to prevent them. But if you are getting cons and calluses, you have to use the salicylic acid based ointments which are available. And you have to keep your feet in warm water. And then you can use, someone has written, yeah, for calluses, pumic stone. You can use a pumic stone, or even you can use what do you say, a foot scraper, a metal foot scraper. Okay, so that is also there. Okay, so you can use that, but the thing is, if you keep your feet in warm water, then and only then these things will easily come off, otherwise they will stay back. Okay, then is glycerine soap good for the skin? Yes, it is very good, because only thing you have to understand, if you have got exceptionally dry skin, then you go for something like, even your Dove would be good, which are cream based soap. But if you are okay with the okay skin, in most of my patients, I would say glycerine soaps are okay. I still go by my word on the old pears, the brown one. I tell all my elderly patients to use pears in summer and rainy season, and if they are going into a cold climate, they can use Dove. Okay, that is my advice to everyone. Then instead of any soap, is it okay to use body lotion for bathing? You mean a body wash or a body lotion? Body wash, yes. You have got gentle moisturizing body washes. You can use that for bathing. That is okay. Okay. What else do we have? Right. What causes fungal bacterial infection? How can we protect? We'll need another lecture for that, Saxena ji. I'll need one more lecture. What causes it? It's a huge thing, sir. But I can just give you that much, that it's a already that there is a immunity which is a factor. There is a dampness which is a factor. Diabetes which is a factor. Even you can say any other even for that matter, fungal infection or bacterial infection in the family. Younger people in the family actually generally get them home. Elderly people don't get, they are not the, we don't call them the index case or the first case for fungal infections easily. Generally, it's a younger kid or a younger person in the family who gets that. Okay. Can body color be lost due to sunburn be restored to original one with medicine? Yes, it can be done. Modi sir, it can be done, because we can do, because the most important thing is we can get it to the question itself has an answer. If you have an inherent body color which is darker, we don't change that. We cannot change that. It is your skin type. But if it is due to the sunburns or something, a good use of medications, sunscreen, lightening agents can help it and get it back to medicine, to normal. Okay. On skin itching, is it advisable to take allergy tablets? It is like taking allergy tablets after the itching starts is like locking your door after the robbery has happened at home. Okay, so don't do that. Rather, if you are having itching, once in a while taking a tablet is okay. But if you have an itching persistently, you have to know what is causing the itching. So get it known what is the disease behind that itching, what is the cause behind it, treat it so that you don't need to take medicines for life. Otherwise, you'll be taking tablets every now and then whenever you get itching, which is not going to help you. In skull, skin patches appear and hairs fall on these patches. Okay. Now this can be because of, this is on the scalp that you are talking about. The scalp patches can be because of, one of the reasons which I showed was psoriasis. There is another one where there you can get is called seborrheic dandruff, seborrheic dermatitis, which is a very severe variety of dandruff that can also cause that. And if skin patches are appearing which are clear, there is no dryness or any patch over there, then these patches are known because of autoimmune disorders called alopecia areata. They have to be treated by a doctor. That has to be seen by a dermatologist. Okay.
Chatting.
Yeah, below the breast, I have a lot of black years before when I had more in the back. That time, doctor said it is genetic. Should I worry now? Because now they are more under the breast. I sweat a lot. Please advise. Uh, Premlata ji, I can say that this can be seborrheic keratosis, which are the age-related changes. There can be another point where you can have those black spots because of the friction in that area. If none of them is troubling you in any way, and if they're not increasing in size, none is getting painful, try to just leave them. Or if you are really worried, then you can just see a dermatologist. And if they say that it's okay, then nothing to worry. I sweat a lot. So then the point is, ma'am, the sweating could be one of the predisposing factors. You could put some dusting powders for that area, which will keep them dry and probably reduce the friction as well in that area. How to detect black fungus infection, which is prevailing nowadays? Arpita I think there is it's a more hyped problem rather than an actual problem, the black fungus thing. So I think we have to just, there are a lot of ways which you have to understand why it is happening, and it is happening. It was a very rare thing before. Now it has come. Mucormycosis was a very a rare opportunistic infection. It has been seen more because people who have stayed in the hospital or who have been on long-term or been on steroids for a longer time on immunosuppression, they are more likely to get it. Again, you might have the nasal stuffiness is one of them, pain in the eyes or something, but it is a very non-specific thing. Don't jump around any particular thing. But if you have some stuffiness persisting for a long time, if you have some skin lesion which is like a ulcer or something, or छोटी सी boil थी जो खुल के वहाँ ulcer बन गई है, जा नहीं रही है, please see a doctor for that. That is how you can understand. Otherwise, it is not something which you can do, reach a diagnosis anywhere at home, okay? Or the suspicion would be difficult. And role of sunscreen lotions, very important. I already said that it has got anti-aging and other factors. It's important. I've already explained that. Apple cider vinegar is good for exfoliation skin. Please don't, at your age, I don't want you doing any of this antics. Please don't try them. No apple cider vinegar for exfoliation. Why do you need exfoliation? You need a keratolytic. You can use a very simple 3% salicylic acid cream. You can use a cream called Moisture X on the soles and all, but not for general exfoliation. And I don't want you to exfoliate your skin. I don't want you to exfoliate your skin. Okay. And every winter I get itching on the skin and I've been diagnosed as xerotic dermatitis. I'm advised to take allergy tablets. Yes, because xerotic dermatitis, the cause is dryness. Dryness is because of the winter, because of inherent dryness. So you have to use the moisturizer if you don't want to take tablets. Don't stop your tablet. Don't stop your moisturizer. You will not need tablets. And any more?
I think, Doctor, the too many questions are coming one after the other. I think we can stop it there. We can take last one question. Can we use coconut oil for dry skin? That's a general question.
Very much, sir. One of the best moisturizers ever made. Ever made the moisturizer. But the only thing with that is, sir, that your moisturizers, the coconut oil doesn't have that ability to give you a sustained moisturization. Okay. And the second thing is that you, if at all you're using a coconut oil in winters, you have to warm it a little. Slightly you have to warm it because otherwise it itself becomes a little thick. So how will it help your easy spreadability? So that is one thing about coconut oil. But you can use a liquid paraffin as a good moisturizer in elderly people, if at all. That is the point is only when people need it so much so. Okay. Otherwise, coconut oil does a good, very fairly good job. Even in on the nails and all. Also, I tell my elderly patients to dip their feet, dip their hands and feet to be very carefully, or they can rub it on the nails. Coconut oil on the nails after a bath. But be careful, don't go it unto, it should not go on the sole. You might just slip or something. So just put it a little bit on the nails, just as a moisturizer. So moisturize your nail because your hair, skin and nails all are made of only one thing, which is keratin. And everything is becoming dry with age. Keratin in general is not there. A dryness is there, means keratin is more. So you have to make the dryness go off. For that, you have to moisturize the skin.
So with that, I think Dr. Manish Gautam, I think we have one of the outstanding sessions, one of the
Thank you,
very knowledge-oriented session, and you clarified more number of doubts than anybody else could do within 1 hour 15 minutes of time. We are extremely grateful to you. We are once again thankful to Agarwal sir to get you, and we look forward to seeing you on some other occasion. It was extremely good session. Let me put on
Yes,
record.
sir.
Wonderful session. Thank you.
Yes, sir.
Thank you,
Thank you,
doctor.
doctor. Thank you, doctor.
Very, very useful, very useful.
Thank you, Dr. Sir.
Thank you, Dr. Gautam. Thank you,
Thank
thank
you,
you.
thank you, ma'am. Thank you, sir. Thank you so much.
Thank you, sir.
It was a pleasure. Thank you.
वो तो अनम्यूट कर रखा होगा ना?
Thank you very much, Dr. Gautam.
Thank you, sir.
Thank you, doctor.
Thank you,
Thank you,
doctor.
Thank you, doctor.
Thank you. Thank you, sir. Thank you, ma'am. The permission. Yeah. Can I take your leave, sir, with your kind
Yes,
permission?
yes, yes, sir. Thank you very much. Thank you.
Thank you, sir. Thank you.
Dr. Pat.